It is known that one of the most deadly cancers, pancreatic cancer, often goes unnoticed until it is too late. If you or a loved one could be saved by recognizing the early symptoms, pancreatic cancer, a very aggressive disease, is usually detected in advanced stages. The pancreas, located deep within the abdomen behind the stomach, is an organ responsible for digestion and blood sugar regulation. This small but vital gland produces hormones like insulin, which regulate blood sugar levels, as well as digestive enzymes that help break down food. When abnormal cells in the pancreas multiply uncontrollably and form a tumor that disrupts these processes, pancreatic cancer begins. Since symptoms can sometimes be ambiguous, mild, or non-existent until the disease has progressed significantly, early detection is unfortunately difficult. This leads to less positive outcomes, making treatment more challenging and less effective. For rapid intervention that can improve quality of life and increase survival rates, it is essential to understand the early warning signs and symptoms. The main topic of today's video is the 10 key warning signs of pancreatic cancer that should not be ignored. Early detection of the subtle signs of pancreatic cancer can be crucial in identifying the disease before it progresses. By recognizing these symptoms, you can take preventive measures and seek help if something doesn't seem right. In managing chronic diseases, improving health outcomes, and even extending life expectancy, early intervention can make a significant difference. Some of these symptoms might surprise you because they are not typically associated with pancreatic cancer. You might already be familiar with some of these symptoms, but you may not know they are linked to this specific type of cancer. The pancreas, about the size of a hand, is located near the spine behind the stomach. It plays a vital role in producing hormones like insulin, which control blood sugar levels, and digestive enzymes. Pancreatic cancer is particularly dangerous due to its deep location and vital functions. Early detection and treatment are quite challenging because symptoms often appear only after the tumor has grown significantly or spread to other parts of the body. The main difficulty with pancreatic cancer is that its early signs are often vague and misleading. The initial symptoms of pancreatic cancer are subtle and can easily be confused with more common and less significant health issues. Unlike other tumors that present clear and obvious symptoms, people may experience mild discomfort, unexplained weight loss, or chronic fatigue, for example. These ambiguous symptoms are often not immediately concerning, causing people to delay seeking medical help. This delay increases the likelihood of the cancer spreading to other parts of the body before being detected, allowing it to grow unchecked. Therefore, it is crucial to be vigilant and know what to look for. People should seek medical help as soon as they suspect something is wrong and make more informed health decisions. Effective disease management and improved outcomes depend on early detection and immediate action, which can save lives. Let's examine the 10 warning signs everyone should know. It is important to consult a healthcare professional for a more thorough evaluation if you or a loved one experiences any of these symptoms persistently, even though they are not exclusive to pancreatic cancer. The body uses these indicators as clues, and by identifying and responding to them promptly, the disease can be detected at an early stage when treatment options are more successful. One of the most noticeable symptoms is jaundice, characterized by a yellowing of the skin and the whites of the eyes. This occurs due to a buildup of bilirubin, a yellow pigment created during the breakdown of red blood cells. The liver usually processes bilirubin, which is then excreted through the digestive tract. However, when there is an obstruction in the bile ducts or a liver problem, as in pancreatic cancer patients, bilirubin accumulates in the bloodstream, causing jaundice. This symptom indicates an underlying health issue requiring urgent attention rather than a disease itself. Doctors can gather more information about the cause of jaundice by observing other symptoms such as itching, pale stools, and dark urine. In adults, jaundice often indicates serious health problems, particularly those related to the pancreas, liver, or bile ducts. These external signs are caused by pancreatic cancer blocking the bile ducts, preventing bile from flowing properly. Second, unexplained weight loss. Weight loss that is not sustained by diet or activity can be concerning and often indicates a more serious health issue. It is crucial to identify when it occurs, as it may signal that the body is not getting enough energy from food, possibly due to an underlying disease like pancreatic cancer. There are several reasons why pancreatic cancer patients may lose weight. Weight loss and poor nutrient absorption can result from the tumor interfering with the pancreas' ability to produce digestive enzymes. Additionally, the tumor can cause a feeling of fullness even after consuming small amounts of food if it presses against the stomach or other digestive organs, leading to reduced intake. Another issue is that malignant tumors often increase the body's metabolic rate, causing it to burn calories faster than usual. It is crucial to seek a medical evaluation if you observe a loss of more than 5% of your body weight over 6 to 12 months without apparent reason, especially if accompanied by additional symptoms. Third, abdominal pain. Another symptom not to be overlooked is abdominal pain, especially if it persists or worsens over time. Diagnosing abdominal pain can be complex due to the many organs in this area, including the stomach, liver, pancreas, and intestines. Pain from pancreatic cancer often begins in the upper abdomen and can radiate to the back as the tumor presses on nearby organs or nerves. This pain typically worsens after eating or when lying down. Initially, the discomfort may be mild or intermittent, but it worsens and becomes more persistent as the tumor grows or spreads. Although less serious conditions like gas or indigestion can also cause abdominal discomfort, it is essential to contact a doctor if you experience severe and persistent pain, especially if accompanied by additional symptoms such as jaundice, unexplained weight loss, or changes in bowel habits. Fourth, digestive problems. While digestive issues are common, symptoms like nausea, vomiting, diarrhea, or constipation that persist or worsen can be concerning. These gastrointestinal problems can range from minor discomfort to severe conditions that interfere with daily functioning. Causes can include dietary choices, stress, infections, and chronic diseases affecting the digestive system. In pancreatic cancer, the body's ability to produce and release digestive enzymes is compromised, leading to inadequate food absorption. This can result in symptoms like fatty stools, steatorrhea, pain after meals, or bloating. When fat is not properly digested, it can cause steatorrhea, often indicating that the digestive system is not functioning correctly. In addition to reducing quality of life, these symptoms can lead to severe nutritional deficiencies and weight loss, further endangering health. Fifth, loss of appetite. A sudden and persistent loss of appetite, especially if it leads to weight loss, can be a serious warning sign. This can be caused by psychological factors like stress or sadness, or physical issues like gastrointestinal problems. In pancreatic cancer, tumors can press against the stomach or interfere with the production of digestive enzymes, leading to feelings of fullness or reduced desire to eat, even after small meals. Food may also become less appealing due to changes in taste caused by the disease or its byproducts. Loss of appetite is concerning as it leads to weight loss, muscle wasting, and nutritional deficiencies, all of which affect immunity and overall strength. Sixth, sudden onset of diabetes. An early warning sign of pancreatic cancer could be the sudden appearance of diabetes, especially in individuals over 50 who do not have typical risk factors like obesity, family history of the disease, or a sedentary lifestyle. The pancreas plays a crucial role in regulating blood sugar levels by secreting the hormone insulin. If a tumor interferes with this function, either by damaging insulin-producing cells or disrupting insulin creation, blood sugar levels can rise, leading to the sudden development of diabetes. Even those who previously had normal blood sugar levels can develop this type of diabetes. A thorough medical evaluation is necessary to rule out pancreatic abnormalities, although not all cases of new-onset diabetes are associated with pancreatic cancer. Since new-onset diabetes often appears before other more severe symptoms, early diagnosis of pancreatic cancer through this symptom can be crucial. Seventh, skin itching. Chronic itching could indicate underlying issues with the liver or bile ducts, especially if not accompanied by visible skin changes or rashes. An accumulation of bile salts in the bloodstream, which occurs when the bile ducts are obstructed and bile cannot properly exit the liver, often causes itching. A buildup of these salts in the body and intense itching can result from pancreatic cancer tumors blocking the bile ducts. Jaundice, where the skin and whites of the eyes appear yellow, often accompanies this symptom, further suggesting a problem with the pancreatic or biliary system. Itching caused by pancreatic or liver issues is usually widespread, continuous, and progressive, unlike normal itching, which can be mild or temporary. It can worsen at night, disrupting sleep and significantly impacting quality of life. It is essential to seek immediate medical help if you experience persistent itching along with additional symptoms like jaundice or changes in stool or urine color. Eighth, fatigue. One of the most common and often overlooked symptoms of pancreatic cancer is fatigue. This type of exhaustion is overwhelming, persistent, and does not go away with rest or sleep, unlike fatigue from physical activity or lack of sleep. Cancer-related fatigue can severely interfere with daily activities, making even the simplest tasks exhausting. In pancreatic cancer, this acute fatigue is due to several factors. The cancer itself can consume nutrients and energy, depriving the body of what it needs to function properly. Fatigue can also be exacerbated by the disease's ability to cause loss of appetite or digestive problems, leading to malnutrition and weight loss. The emotional stress and tension caused by a serious illness can also contribute. Additionally, fatigue is a severe side effect of treatments like chemotherapy, commonly used to treat pancreatic cancer. These side effects worsen the already debilitating fatigue of the disease. It is crucial to consult a healthcare professional for further evaluation if you experience chronic fatigue that does not improve with rest and is accompanied by other symptoms such as weight loss, changes in appetite, or stomach pain. Ninth, blood clots. When blood accumulates in the veins or arteries without injury, blood clots can form, often referred to as thrombosis. Although clots are often the body's natural defense against bleeding, clots that form spontaneously or do not dissolve on their own can have serious health consequences. For example, they can travel to the lungs, causing a potentially fatal pulmonary embolism, or block veins, leading to deep vein thrombosis, DVT. Since cancer cells can release chemicals that promote clotting, pancreatic cancer significantly increases the risk of blood clots. This explains why some pancreatic cancer patients experience clots without apparent reason. DVT is characterized by pain, redness, and swelling in an extremity, usually the legs. Sudden chest pain, shortness of breath, or even collapse can result from a clot reaching the lungs. This is a medical emergency requiring immediate treatment. It is essential to seek medical attention as soon as you notice these symptoms, especially if they co-occur with other pancreatic cancer symptoms like weight loss or jaundice. In addition to preventing further complications, early detection and treatment of blood clots can allow for further investigation into underlying causes, such as pancreatic cancer. 10th, changes in urine or stool color. Important health indicators can be found by paying attention to changes in urine or stool color. Under normal circumstances, urine ranges from light yellow to dark amber, depending on hydration levels, and stools are brown due to bile, a digestive fluid produced in the liver. However, significant deviations from these colors can indicate a serious health issue. For example, pale or clay-colored stools can signify a bile duct obstruction, which can occur when a tumor presses on or blocks the ducts. Due to this obstruction, bile cannot discharge into the intestines, resulting in abnormally pale stools. Similarly, black urine can indicate dehydration, but if it persists despite adequate hydration, it may also suggest a liver problem or bile duct obstruction related to pancreatic cancer. The color of urine and stools can be significantly affected by a tumor disrupting the bile duct in pancreatic cancer.